Welcome, everyone, to our episode of Milk Minutes presented to you by Healthy Starts Center for Urban Breastfeeding. I will be your host. My name is Ashley Hall, and I am the program manager of the Center for Urban Breastfeeding, affectionately known as the CUB. The Center for Urban Breastfeeding is a Healthy Start initiative to address and bridge the gap of breastfeeding initiation for Black mothers and Black babies. Our services are free for individuals living in Allegheny County. Our services include telephone, virtual, and in-home support. For access to lactation professionals through our latch line, simply call 412-545-2022 and press option 1. You'll be connected to a lactation professional within 20 minutes. We also offer Breastfeeding 101 classes where we get our families prepared to breastfeed successfully. In this class, you'll know the process of how breast milk is made, how to maintain your supply, and when you should reach out for help. I am excited to share that this year we will be launching our Pump It Up curriculum, which will help our families prepare their pump journey for going back to work. We also offer monthly education through Milk Minutes. This is where we discuss breastfeeding related topics. November is recognized as Prematurity Awareness Month, a time dedicated to spreading awareness about preterm birth, its causes, and its impact on families. Today, we are honored to have Denise O'Connor as our guest. Denise is the founder and executive director of the Mid-Atlantic Mother's Milk Bank, a groundbreaking nonprofit she launched in 2015 to provide life-saving donor milk to vulnerable infants. As an international board-certified lactation consultant with over 20 years of experience, Denise has dedicated her career to supporting nursing mothers and infants. Her work extends beyond the milk bank. She's collaborated with local nonprofits like the Three Rivers Adoption Council, the Midwife Center, and the Pittsburgh Toy Lending Library, showcasing her passion for women's and children's health. Under her leadership, the Mid-Atlantic Mother's Milk Bank has transformed neonatal care in Western Pennsylvania. Before the milk bank opened, no local hospitals used donor milk for premature babies. Now, all higher-level NICUs in the region rely on it, improving outcomes and supporting families when they need it most. Join us as we dive into Denise's inspiring journey, the role of donor milk in infant health, and how her work is making a difference for families in our region. Welcome to our episode of Milk Minutes. Denise, how are you?
I'm doing fine, and I'm so delighted that we're representing the milk bank here today. We want everyone to know that we're here and how we can help um, the littlest babies in our community thrive.
Yes, yes, yes. So I did give a nice introduction about your history, but could you share what prompted you to get into this field?
Sure. As a lactation consultant, working for a number of years, I would see at conferences or reading in journal articles or seeing in seminars what donor milk was doing all across the country. And quite honestly, I just couldn't believe that we were not using it here. We had not a single hospital utilizing donor milk. And that's even despite the fact that the American Academy of Pediatrics issued a statement in 2012 basically saying that every single low birth weight baby, so those babies that are born 1,500 grams or less, which is about 3 1/3 pounds, should be receiving nothing but donor milk if they do not have access to maternal milk. So despite all that, we just weren't using it here in our region. And one of the biggest barriers was the fact that there weren't enough milk banks in this part of the country. So the next closest milk banks would have been Columbus, Ohio at that time, North Carolina, or Boston, and
Oh,
that's
wow.
it. So, right. So,
Mm.
so I had done a lot of work with nonprofits in the maternal and child space, and I thought, you know what? Let's see if we can tackle this. So I cold called the two biggest NICUs here in Pittsburgh. So I cold called the NICU at McGee and cold called the NICU at West Penn and said, hey, I'm a lactation consultant thinking about whether or not there might be a need for a milk bank here. And both of those units, their directors called me within an hour,
Oh,
called me back
wow.
after I left that message.
Oh,
And they said, yes, we want to start using donor milk. We didn't think that the available milk banks would be able to handle everything that we needed. And so those two physicians came on to be some of our founding board members. And then we went and got some other folks that are experts in the community, including Dr. Deborah Bogan, who is now the Pennsylvania Secretary of Health. She's a breastfeeding expert, a pediatrician, worked in academic medicine. And then also, I always laugh and say that we kind of got the band back together from the Midway Center because I was on the board there back when it had opened. And so a couple of the board members from that original board 20 years ago came on. So it took us about a year and a half to raise the funds to open up the space that we're currently in, a little 5,000 square foot space that we've leased and occupied since that time. And then we opened in 2016. And what a ride it's been since then. I mean, we've really been experiencing a growth trajectory that is like this because the babies just do so well on donor milk. So
absolutely. Thank you so much for sharing that. I think it's amazing that you were able to identify the need and then jump right in and just take action. So, just for some background information for our families who are unfamiliar, can you explain the milk bank and how it operates?
sure. So I always like to explain it, comparing it to something we're more familiar with. So basically, we are like a blood bank, but we're for human milk. So we're getting donations from volunteers. They're uncompensated volunteer donors. They go through a screening process, and then the milk itself is tested and processed for safety. So we are a nonprofit milk bank, and we are accredited by the Human Milk Banking Association of North America. So that organization accredits I think there's 33 now, milk banks across Canada and the United States. And so those guidelines from Habana, they encompass everything that we do from how we screen our donors, what medications we can take and supplements, how we process the milk, how we test the milk, how we distribute the milk. And those guidelines have been around for, oh gosh, almost 50 years now with an exceptional safety record and are deemed the gold standard when it comes to safe and ethical milk banking. And so the nonprofit network of milk banks, which there's 30 of us in the United States, that's what all the neonatal intensive care units, that's who they turn to for their milk supply. And collectively, we serve over 90 some percent of the NICUs across the country.
Oh, wow. Wow.
Yeah.
So you did mention that the process that the milk goes through. Could you explain briefly, just to inform our viewers, what that looks
Oh,
like?
sure.
Yeah.
Well, absolutely. So the recipients that we're seeing are primarily very fragile. So we are talking about preterm infants in the neonatal intensive care units, children who have gastrointestinal issues, children who have cardiac defects. About 80% of what we do goes to babies that are in the hospital setting. The other 20% are outpatients, and most of our outpatients are very sick. They have exhausted other nutrition options. They're not thriving even on prescription formulas. So these are all children that are vulnerable, very vulnerable. So things that may be okay for nursing your own baby, and the risk-benefit ratio would be very different, is different for milk donation. And so the donors themselves have to be screened. And so it's a simple, but it's a thorough process. It involves about a 15-minute interview with one of our screeners. And so that's done over the phone. We also do a little application packet with just some deeper questions about medical history, medication supplement use, things like that. During this whole time of the screening process, there's opportunities for the potential donor to ask us questions. We let them know how the rest of the donation process is going to go, and really develop a rapport with them. So after we do the interview and the application packet, we do send a a one pager off to their doctor and their baby's doctor. We handle all that, but we do show the donor what we're asking them about, basically confirming the medications surrounding the birth and things like that. And then just making sure that the pediatrician is aware that that this mom is a donor and making sure that her baby has all the milk that their baby needs because their baby comes before donation. And then we do blood screening. And so we're looking at the types of bloodborne pathogens that can pass through human milk. So we're looking for HIV, HTLV, syphilis, and hepatitis. Now I know that's the whole screening process, and I know that sounds like a lot, but it really is not. We try to make it as easy as possible, but this is all very necessary because of the fragility of the population we're serving. Then once we get the milk, and the way that we get the milk, there's lots of different ways for moms to get it to us. People are always shocked to learn how big our service area is. So we're not taking care of just Pittsburgh. We take care of all of Pennsylvania. We have
Oh,
nearly
wow.
every NICU in Pennsylvania is getting their milk from us. Plus, we take care of all of West Virginia, and we take care of many hospitals in New Jersey and Maryland and outpatients in Delaware. So, that's a lot of donors from all over the area. About a quarter of our donors come from the greater Pittsburgh area, and the rest are coming from outside that area. So they can ship their milk to us, and we have a way to do that. We send them an empty box, instructions. We have FedEx or UPS come to their home and pick it up. All of this is paid for by us, of course. Or we have some depots that are scattered throughout the state. So lactation centers, organizations, similar to your organization, or pediatric practices or hospitals that have a freezer for us that their local approved donors can drop off to. So then once that milk comes to us, it comes to us frozen, and then we have to mix it. We actually mix the milk of several donors together because it increases the diversity of all that good stuff that's in the milk, like the immunological factors and those milk sugars, that human milk oligosaccharides, and that's all the secret sauce of what's protecting those babies. And so we get more diversity if we're combining, 4 or 5 moms together. And it also evens out the natural variations in nutrition between the donors as well. And then we take that mixed milk and then we bottle it and then we have to pasteurize it. So we have to heat treat it. We are required by our accrediting body, but also by the state, which regulates us to pasteurize that milk because the babies that we're helping are sick or they're very premature. And so bacteria and viruses that wouldn't be a big deal for a full term or a healthy baby could be very, very problematic for them. So we're heating that milk up in the bottles, and it's a low enough temperature where it's keeping all the good stuff in the milk intact, but it's high enough that it's getting rid of the bacteria and viruses. And then we do some testing on the milk too. We test it for bacteria after we pasteurize it, and then we do 2 types of testing that are not common. We can actually analyze the nutrition content of our milk here. We are lucky enough to have a Mirus human milk analyzer here, which is a special medical device that's approved by the FDA that measures the calories and the fat and the protein and the carbohydrates of the milk. And the neonatal intensive care units use that information to make very customized nutrition plans for preterm babies. And then we also drug test our milk. We're one of only 5 nonprofit milk banks in North America that do that.
Amazing. Thank you for that overview. I hear that the process is very thorough, and I love how you mentioned or how you called it the secret sauce. You
It
mentioned,
is.
yeah, it is. That's amazing. You mentioned that many of the recipients they're fragile, and could you share what are some of the benefits of this secret sauce that the donor milk offers?
Oh, absolutely. So, human milk, mama's milk, is the most important because even donor milk, yeah, we can fill in the gaps and we can protect babies, but nothing compares to mom's own milk because it is tailored for her baby. We make special milk as moms if we deliver early. We make preterm milk, which is different for the baby. Our lactation changes throughout the whole course of when we're nursing our child. And we're exposed to things in the environment that we're making all these different immunological factors that are specific to that baby. So mom's milk is perfection. So we're filling in when mom's milk is not available. Now, human milk is the perfect nutrition for babies, but but human milk in the NICU is even medicine, really. It is protecting babies from serious complications. And so there are babies who are born preterm, who are born early, or have specific conditions that they're born with, are at a much higher risk of having complications, and they're prone to lots of complications in the NICU. And so we know that keeping those babies on a human milk diet and filling it in with donor milk as needed is will protect them. So there is one particular complication called necrotizing enterocolitis, and that is a mouthful. We call it NEC. Necrotizing means death, and colitis, intestines. It really is an inflammation of the intestines that can lead to the death of the intestines. Happens to 10% of preterm babies, significantly premature babies. Half of those children will require surgery to remove the portion of the intestine that's affected, and that surgery has a very high death rate. And those survivors of those of NEC, they may have to deal with lots of different complications and surgeries and treatments in the first few years of life. It can impact neurodevelopmental outcomes. It's just a really devastating complication in the NICU. But believe it or not, just the simple provision of human milk, we can get rid of 80 to 90% of those cases and get rid of nearly the vast majority, if not like nearly all of the neck surgeries. And so, truly, when we say that donor milk is life-saving, it is life-saving. And then we know in the units that use donor milk and this is such a win, is that we know that when donor milk is used instead of formula in a unit, that the chances that that mom is going to eventually exclusively breastfeed is way up. And we see that not only in the NICU with babies who are sick, but we've been seeing an expansion of use because those babies do so well. The cases are so documented, the data is so robust when we're talking about neck, that gut infection. And as a matter of fact, our hospitals that started using donor milk a few years ago when we came on board, they saw a 90% decrease in those surgeries, which is amazing to see. We had a very large NICU here that went from having 12 of those surgeries a year to 0 or 1 every single year. And that means those are lives saved. So now everyone's starting to expand donor milk use to other populations, to babies who have cardiac issues and to GI issues and babies who were born exposed to opioids in utero. That our units here in the region have been finding that those babies have less withdrawal symptoms and need less interventions if donor milk is used instead of formula. Supplementation is needed. And now we're seeing something that's so cool to watch, because those areas of the country that have had milk banks for decades, we're finally getting to the point where they're at, which is we have hospitals now using it for well baby. So we have one of the largest health systems here now using it for babies who are born full term or just a little bit preterm and need a little bit of supplement for some reason and mama's milk hasn't come in. And again, we know that if we use donor milk in that case instead of formula, that it's more likely mom's going to be successful at breastfeeding. And we also know that that's really important, that exposure to human milk in the first few days of life, to get an optimal and diverse microbiome, which we know from everything that you hear now and on the news, all we know scientifically that the microbiome is so incredibly important for health, not just infant health, but health throughout the entire lifespan.
Thank you. Thank you so much. How can our families access? What is the process to access donor milk?
Sure. So in the hospital setting, the hospitals actually order milk from us as they do any supply. And then each hospital system has its own criteria on what diagnoses and how they use that milk. So really, if your baby's hospitalized, the medical team is the one. If your baby, would be in need of donor milk, that it's likely that the medical team will come to you and suggest it. Or if there's the option of what we call bridge milk, that's the well baby milk. If your baby needs supplement, at some of our regional hospitals now, that's offered as one of the options. You could either do the donor milk or you could do formula. Now, for our outpatient infants, it does require a prescription, and that is state law. So you would have to require a prescription from a physician. And it also, a lot of insurances now pay for donor milk. So we worked tirelessly for, oh gosh, over 6 years to fight for Owen's Law. Owen's Law went into effect in January of this year, and it's been a game changer because donor milk is out of reach for families. It's a critical medical service. All of those things that we do to make that milk safe costs a lot of money. You've been here, right? You see everything
Yes.
that we do, from the blood work on the donors to shipping the raw milk to us to even buying those little bottles that it comes in. They're special bottles that can be heated up and are for breast milk. They cost $1 a piece, just even those. And then all the testing we do and the chemicals that we have to buy to do the testing and all the staff time. So donor milk is $4.50 an ounce, which is actually on the low end of the processing fees for nonprofit milk banks in the country. So the milk itself is free because it's generously donated. The milk processing fee is all that stuff that we're required to do to make it safe. So you can see how, on the hospital side of things, the hospitals are the ones that are carrying that cost. It's just part of the payment they get from the insurance company, and nutrition's part of that. So they're paying for it. But on the outpatient side of things, you could see how this would be absolutely impossible for a family. It could be, a baby could be drinking 25, 30 ounces a day, right? A child who's dependent on donor milk and is sick. And so insurance coverage is absolutely imperative to make sure that everyone has access. And so Owen's Law is a mandate for medical assistance requiring that donor milk is covered for babies with certain medical circumstances. The vast majority of our outpatient recipients are medical assistance eligible because of the complexity of their children's, medical complications. So we're trying to bring down the access barriers. We also have charitable care programs to fill in the gaps as well. And so, inpatient, ask the medical team. Outpatient, ask your pediatrician.
Excellent. Thank you. That is a major win. That's a game changer. Owen's Law.
It sure was. And man, was it a struggle. It took us 2 sessions to get that accomplished, but we've really seen that in action. We've had multiple families that have directly benefited from Owen's Law. Some of them have shared their stories, and we're going to be posting videos up on our website pretty soon from those families. And this is a critical medical service, and it is just as life-saving. It is just as needed as a blood transfusion or any other critical service. And nobody's having to do charitable care or a bake sale to get a blood transfusion, right? And so this is just as important. And having that coverage is so important because that way the physicians have the confidence to prescribe it because they know that it'll be able to be, that the family will be able to afford it. So it was a tremendous, tremendous win.
Yes, thank you. And as we're ending our conversation today, I have two more questions.
Sure.
Yeah, what is one misconception that you would like to address as far as human or donor milk and its role in the infant's life?
Oh my goodness, there's so many. Well, the biggest one that I touched upon was the cost factor, because I know that there's this misconception that, oh my goodness, that we're a company and we're making money off of the donated milk, and our donors, my goodness, we know the time and the energy and everything that goes into pumping. They're truly our heroes. And so sometimes we'll see things on social media where people are like, why is there a charge for the milk? And it's just like at a blood bank. There's cost associated. So, we're a little nonprofit. And so people are kind of a little surprised. Sometimes they think that we're some big corporation or this is a pharmaceutical company or something like that. It's like, nope, we're just 13 employees serving 82 hospital units. We distribute now over 40,000 ounces of milk a month, which is mind blowing.
Yes, it's
Absolutely mind
amazing.
blowing. Right. So this is a grassroots started organization. It is able to exist because of our generous donors, all those families that rally around the milk bank and share their excess. And then our volunteer board members. We have volunteers who volunteer at the milk bank. Our staff is so dedicated who come in and extra, extra hours sometimes. As a matter of fact, our lab staff's been staggering shift and doing extra time because we had a huge increase recently in use amongst all of our hospitals, and they're all in. So we're fueled off of generosity and passion. And I mean, and when we meet some of the recipient families and see what donor milk has meant for them and how well they're doing now, and oftentimes that mom is making all the milk her own baby needs, and the donor milk was just a step up for her, just bridging a gap for her. I mean, it's just awesome.
Yes, yes. Thank you. And then one last question. How can our listeners stay informed and how can they become involved?
Oh, absolutely. So go on our website. We have so much information. If you have more milk than your own baby needs, check out donation. There's all sorts of information we have about donating right there online. And you can even do a little pre-screening and set up a phone interview to start the process right there online. Follow us on social media and, spread the word about donor milk because we want to get to a place where everyone knows about us, where a family, if a medical team suggests donor milk to that family, we don't want it to be the first time they've ever heard about it. And we want families to know if they have milk to spare and they can share to reach out to us. And when we have broad knowledge about the milk bank, that's a huge testament to how important human milk is, right? And how important breastfeeding is. So it's a message that extends well beyond. So our mere existence is proof that breastfeeding counts and makes a huge difference in the health of babies and mamas too.
Thank you so much, Denise. I really appreciate you taking the time to share with us the benefits of donor milk and how our viewers can be recipients and also take part of donating their own breast milk. This will conclude our episode tonight on our Milk Minutes episode. If you have any questions or need lactation support, please don't hesitate to give us a call. Again, we can be reached at 412-545-2022, option 1. Have a good one, everyone. Thank you for tuning in.